remarks. It is, again, a pleasure to recognize the gentleman from Pennsylvania, Dr. Joyce.
Thank you, Madam Chair. Thank you for this important hearing. We're approaching 10 hours that you've been here, and yet your impact by coming here to the People's House is so important. Mr. Wallach, I will never forget your words. I want to present a question to you, and you've presented challenges to us today. If you had to choose between the problems that we've addressed, would you look for more innovation, more accessibility, more flexibility, or more urgency and response?
Can you turn the
Yes.
microphone on? We don't want to miss one word.
Sure. The flip answer? Yeah, the flip answer is that he would choose all of the above, but
The most important thing to patients alive today.
but the most important thing to patients alive today
They have access to promising therapies and women to successful process.
that they have access to promising therapies that are moving through the clinical trial practice today.
We look at the opinion
We look at what?
and
Oh, we look at the European Union
the conditional approval pathway
in the conditional approval pathway
in the fact the anti-conditional approval pathway for animals in the U.S.
and that we have a conditional approval pathway for animals in the U.S., but not for human beings. It begs the question why we aren't doing everything we can to get therapies to people who are dying and to have the science, to have the chance to live to see a possible cure or cures.
Thank you for an honest and a courageous answer. I'm going to take that answer and pivot to Dr. Esham. Dr. Esham, the clinical trials process can be long and incredibly resource intensive, and especially with the delays that COVID has caused for patients in the clinical trial process, which really exacerbated what Mr. Wallach just stated, and he's nodding in affirmation of that. Are there actions that can be taken or policies enacted to redesign clinical trials to account for the interruptions that have been caused by the COVID pandemic?
Thank you for that question. We, at the very onset of the pandemic, we worked with very quickly with our member companies to continually engage with the FDA to make sure that we understood how to document any disruptions or any missing data that may have occurred due to revamping operations during the outset of the pandemic. We currently are operating under the assumption that the FDA did put out guidance very quickly and put out iterative guidance over the course of the spring and early summer. So we were operating under the assumption that that issue should not result in undue delays in programs, but that is an area that we're monitoring very closely.
Thank you for addressing what Mr. Wallach put forth. These delays are so important for these people. Time is of the essence. Time is limited. Do you feel, Dr. Esham, that there should be other steps such as allowing increased patient access, which Mr. Wallach just talked about, for investigational drugs outside of the clinical trials, and that we should be mindful of to account for the disruptions that have occurred in this pandemic?
Again, thank you for that question. And again, we are supportive of the fact that there is that expanded access is a tool in the toolbox that can, where companies can provide, can make a decision to provide that medicine, investigational medicines via expanded access. But if I may, I just want to underscore some of the other revolutions that I think are also important in the entirety of this conversation, and that is, again, some of the things we learned under the pandemic, and that is, how can we bring the trials, the actual clinical trials themselves, closer to the patients and in a way that reduces burdens on patients. So in addition to expanded access, I just want to make sure we're also focusing on improvements to the ability to enroll people in clinical trials based on tools and designs such as decentralized trials, telehealth, all of those types of things, in addition to the expanded access conversation.
I think that innovation is so important. My time has expired, but again, thank you, Madam Chair, for this incredibly important hearing today. And thank you for being here at this late hour.